You're listening to the RC Executive Lounge Podcast, the show where healthcare revenue leaders share real-world strategies, hard-earned lessons, and bold ideas shaping the future of revenue cycle. The views expressed by guests are their own and do not constitute endorsement of any specific product or solution.
Hi, everyone, and welcome to another episode of Season 2 of the RC Executive Launch Podcast series. I'm your host, Praveen, and I'm really glad you're all joining us today. I'm super excited today to welcome a guest whose revenue cycle leadership journey has spanned multiple major health systems across the Southeast and who has now returned to lead at one of the most important community-focused health systems in the region. Our guest is Chris Spady, Senior Vice President of Revenue Cycle at Chattanooga, Tennessee-based Erlanger Health System. Chris recently returned to Erlanger after serving as Southeast Division Vice President of Revenue Cycle for Chicago-based Common Spirit Health, where he spent 2.5 years following his earlier tenure as Erlanger's VP of Revenue Cycle from 2019 to 2023. So this is very much a homecoming for him. In sharing the news of his return, Chris said he is grateful for the opportunity to come back to an organization and community that means so much to him. Chris brings more than 2 decades of progressive revenue cycle leadership with earlier roles at Riverside Health and Centara Healthcare in Virginia. He holds an MBA in healthcare from the George Washington University and a BS in healthcare administration from James Madison University. What I find particularly compelling is the philosophy Chris brings to his work. He describes his teams as taking on the business side of the patient experience and has said, healthcare can be frustratingly confusing. Our job is to make sure patients understand each step in the process. That patient-first mindset has translated into concrete results. During his earlier tenure at Erlanger, Chris led a financial transformation that included initiatives like submitting infusion claims per session instead of monthly, yielding an $8 million cash acceleration. He has also expanded the health system's charity program, noting that by handling patients with compassion, we have actually increased collections. A quote he has shared that captures his approach comes from C.S. Lewis. Favorable conditions never come. Chris describes his own style just as simply. I come at things calmly, but I like to win. That's a powerful leadership mindset. We'll talk today about his return to Erlanger, his philosophy of compassionate patient financial engagement, how he thinks about technology and automation, and the leadership lessons he has learned along the way. Now let's welcome Chris Spady. Chris, welcome to the show, and thank you so much for joining us today.
Hey, thanks, Praveen. Thanks so much for having me.
Perfect. With that, let's dive right in today. Now, Chris, most organizations have claims denial management as a multi-year ongoing initiative. How does it work in your organization, and how do you typically determine the priorities for this program? Like, what is your framework in approaching this program?
Sure. I think denials management is a forever initiative, unfortunately. I like to imagine a world where there's not denials and what that would do for patient care, and just if we could just refocus so much of what's spent back to patient. But of course, we know that that's not the world that we live in. Um, I think from a cost perspective, I don't know if the public realizes that care is actually very rarely denied. It's just the reimbursement after the care happens. So from a cost management standpoint, we're really not managing cost. It's just reimbursement on the other side of things that makes us manage costs that much more on the provider side. But, at our organization here at Erlanger, several layers of denial management. It's important. There's a governance layer, first and foremost. And so our CFO kind of oversees those. And we have, different, based on the different segments of the revenue cycle, we've got those governance layers. And then there's operational layers as well, which go down to myself, down to the directors. Um, all of it is about making sure we're moving KPIs, but also making sure that we are true owners of our denials. And that's kind of the expectation of our leaders. So I think from a framework perspective, that's kind of how we do it, governance and operational. And it's like anything else. There's always a challenge, a new challenge in the denials world, but we are going about it like everyone else is, I think.
Perfect. Chris, when I look at your past experience, You are one of the leaders that I've come across who have worked in some pretty large health systems across the nation. So, looking at all your past experience and the data from your past experience, what are some of the top reasons driving denials? Like, what patterns have you observed in data, not just in Erlanger, but when you look at Conspirate Health and every other system you've been at in the past, what does the data tell you?
Yeah, denials have changed quite a bit. I mean, if you just look over the last 5 to 10 years, we have moved from a realm of, 85%-ish technical denials to now we are all, above 50% clinical denials. And so
Wow.
that has changed from a, hey, revenue cycle can manage this for the most part. Maybe there are conversations we have with departments to we have a very long runway to manage the clinical denials. They're cross-functional teams. We've got to bring in more clinical staff, and so that's been the biggest change that we've seen recently. The claim or the 835 remit may say, hey, it's a medical necessity denial, but we are very rarely arguing medical necessity anymore. We're arguing should it be inpatient, should it be outpatient, and there's just a tremendous financial gap there, and it's tougher to do. We've got payers who are refusing to do peer-to-peers now, and so where you've gone from a world where you are winning, 70 to 80% of those peer-to-peers to where you have to fall back on that written appeal, which has a much, much lower win rate. So I think that's what we've seen, large organization or small organization. That is kind of the fight right now, is making sure you still have to do all the technical things that were important before, but now it's really from a clinical perspective, and are we making the right decisions, and are there partners that can help us do that, and what ultimately is the end result of those things? It's just, it's a very long runway. It's not a 1 to 2 claim process. It's a claim process. It's appeals. It's letters, and so the game's changed a lot in that respect.
Makes sense. And typically, as you think about this multi-year program, there are always competing priorities that might take resources and bandwidth away from this program, right? What are some of those competing priorities that your teams face in this program? And how do you determine priorities between like operations requirements and innovations requirements? And the nature of the question here is really in this kind of a multi-year program, operations could eat into innovation, innovation could eat into operations. There's a healthy or unhealthy tension, between these two types of requirements. What are some of those competing priorities, and how do you as a leader deal with those priorities?
Sure. I mean, it's a great point. There's always competing priorities. We could all have full-time jobs just by showing up to the meetings, put on our calendars, and answering our emails, right? And sometimes we're really not being super productive by doing those things. So, um, inclusion and progress is the first thing. We want to be inclusive of everyone, but I am a big believer in small teams move fast. And so it's hard to get something done in a setting where 25 or 30 people do those things. And so we have to trust each other from a revenue cycle to make sure we're communicating with each other. That messaging is getting out, but from a decision standpoint, if you are one of the small team members, you are there, you're engaged, and helping to make decisions. So that's always a balance. I mean, just this week, I failed to tell one of our leaders something, caught her off guard, not her fault, but she called me. We had a phone conversation, and you have to trust each other like that. To say, hey, this was not intentional, and it happens, and it will happen again. But I think from an overall requirement standpoint, everything just about takes IT these days, right? And so we're thankful for them, and that's really how another way that this world has changed. It wasn't that long ago. We used to have Steve, and we'd call Steve and say, "Hey, we've got this high priority project, and can you get it done?" And it might have been a Tuesday, and he would say, "Chris, I'm swamped, but I'll get to it by Thursday." Now it takes Tuesday and Wednesday to fill out the form, to send it in on Thursday, to go to a committee, to go to, and all those things are important. But it's different because, again, it's a different world, cyber and just the IT bandwidth and everything that we have. So that's got to be a part of the decision. Even if we agree that it can get done, where does this fall on the priority list from IT? Opportunity dollars are a big one. It can't be the only thing. It's not just about dollars. I manage both the hospital and the physician side, and you've got to make sure you're balancing your team. But dollars are a big thing. Speed to implement, how long that's going to take, and really KPI position too, because you might be doing well in something, and there might be a good product or something that comes along that could really help you, but say, hey, I've got a bigger gap in this other area, and so kind of focus on those. You know, I think the other thing is everything is changing with this AI world, right? And so it wasn't that long ago that I would say, "Hey, let's see what's happening," right? Someone would say, "Hey, we'll come in and automate it," and I would say, "Fantastic, go show me where you've done it before." And it was hard. The industry's moving so fast. It's hard for people to say, I can't show you, but I'll build you what you need. Like that's not necessarily what we're looking for. Now with AI, it's gone from let's watch to see what's going to happen to we have to be really involved and engaged in it. And the thought of signing a 3-year contract today is very different than it was just 2 or 3 years ago because I think we are moving so quickly, and that's exciting. It's a really exciting time in the industry. And I know that's not a short answer to your question, but you have to try and balance all of those things to create your priorities.
No, absolutely. Completely understood. And Chris, I know while you were talking, we both were smiling at the point when you said you say something on Tuesday and Steve is able to get to it on Thursday, but now it takes 2 days to just fill out the form. So I know we both were smiling, but the deeper message behind that message did hit me hard. So that's why I was smiling. So nonetheless, anyway, for a program like this, I've heard that the best in class have denial rates as low as like 4%. And some other organizations who've had bandwidth constraints and other constraints have had denial rates as high as like 27%, right? So the range is pretty wide. For a leader such as yourself who've been in this industry for so long, what do you think is a right success target for any organization for any year in this program? And even when you think across multiple years, when do you know you're close to achieving your vision for this program? So the nature of the question really is, when does it feel like the incremental ROI is minimal as you keep investing in this program?
No, that's a great question. I think one, you have to know the data. You have to understand are we talking about initial denials? Are we talking about what we term fatal denials? Are we talking about writing things off at a net level? Or are we talking about writing things off at a gross level? Because that can really change your numbers and your comparisons. Um, we really use a lot of the financial pulse in Epic. That's one thing I really enjoy, and there are several different ones, whether it's a denials pulse or the overall pulse or the access and so on, because that truly gives us the most apples to apples comparison that we can get to. Not perfect, but still allows us to see not kind of static number we used to have. We grew up on what we had at the time, the HFMA metrics, and they were kind of static. And sometimes they were people's opinions. They've come a long way on those now to what's happening. If we've had a denial spike on initial denials, for example, do we see that in other health systems too? It's amazing how the industry tends to move together, even though we're not changing things too much on our end. So I think that's important. Um, we we actually still are at a gross level, which is a little bit atypical. So we don't write those. We don't have a time of billing write down right now. Have been in systems that do have a time of billing write down, and honestly, my opinion, and I don't think a lot of others share it. It's just you spend so much time talking about contractuals that where the claim paid correctly, we just didn't contractualize it correctly, and so that you waste so much time on that. So we look at a gross perspective. We try to be at under a 2% fatal, write-off perspective. And then from the metrics that we see in our comparison, it's right at that 10% initial denial rate on the hospital side, maybe a point or two difference on the PB side, but that's what we're really shooting for. And then Epic does a great job of breaking down in what area is it access, is it coding, is it back end? And so that's how we're really measuring everything, where we want to be. And this is just a big part of what we do on our teams. We want to be at the front. And so that's if you want to be part of the team that, you kind of we want you to be driven to be working towards that. And very fortunate that we got a fantastic team here at Erlanger, and our leaders really are. And so I don't know that there's a finish line in this business, right? There's not a line that we're going to cross and have made it, because everything changes, everything continues to change. But we're always looking to get better, and sometimes better is how do we collect more? Sometimes better is how do we maintain where we are, but can we cut some costs out of this? So we're kind of looking at both sides of the coin.
Makes sense. Chris, great sense of insights. With that, let's move to the next segment. But before we move to the next segment, let's take a short break. We'll be back soon.
This episode is brought to you by rchq.com. That's ARCEEHQ.com, the Agentic AI platform helping healthcare providers improve financial performance by simplifying patient financing and financial assistance. From faster approvals to fewer write-offs, RCHQ makes it easier for patients to pay and for providers to get paid. Learn more at rchq.com.
Welcome back, everyone. Chris, let's jump right in. Let's dive into a recent claims denial management initiative that you and your team led. Maybe let's start with what challenges were you solving for?
Sure. So overall at Erlanger, we talk about being three things here in revenue cycle. We want to be on time. We want to be front and center to leaders and executives and our customers and patients. And we want to know the score. So if we do those three things, that's what's important. And so it's the very first one that we have tackled a little bit more since I've been back. And that's being on time. And so, we're an Epic system, and thankful for Epic. We're Epic first wherever we can be. But recently we have implemented workflow software for our follow-up team. And so that is, again, really about being on time. Sometimes the issues are not about amount of data. Epic can tell us what everyone's doing down to the second, right? It's about consumption of data and being able to make decisions off of it. And so that's really what we've partnered with someone to do to make sure we're serving our follow-up staff the right accounts, but understanding what the capacity is on those things too. Hey, we have X amount of accounts that are due for follow-up today. Do we have enough capacity to work those on time? And so that's what we are working towards, kind of like we talked about before, DNFB and CFB. Those are the important things that we're always looking at. But how do we make sure our team is on time overall? So that's one of the things that we have just recently kind of kicked off in the 6 months that I've been back.
Makes sense. And you mentioned that you're partnered with someone. So once you identified the challenge, how did you go about selecting a solution or partner? So the nature of the question here is there is always that tension when you talk to the IT team between like build versus buy. How did you resolve that tension?
Yeah, that's always a part of it, especially as we look at costs to collect and everything. And couple things. One, we felt like that something that's already built, Epic may have the ability to do this, for example, and I know other systems are successful with kind of using the workflow tools. I mean, you've got your work queues, you can give it scoring, but you have to create all of that, right? And so someone who is further down the road may be a better option sometimes than building it ourselves. And that's what we decided ultimately here at Erlanger. And so to me, I'm not a logos guy. It's not, hey, we've got to use the biggest, very much a relationship person. And so got to know who not only who works there, but understand who's running the company, how big they are, how they're growing, speak with other clients of theirs. And ultimately it comes down to trust too. We can sign contracts all day, but I really don't want to get in a partnership where we're going to go back to page 7, paragraph 3 of something that neither of us have ever really, understood or looked at. We want to make sure we're on the same page of where we're going to go, what we think we're going to get, and what they can deliver. And so that's how we kind of go about selecting partners.
Makes sense. And let's talk about implementation. What did that look like? And as you proceeded with the implementation, most projects always, throw these curveballs out of nowhere, right? So were there any such pitfalls, surprises, or lessons that you could share with our audience?
Yeah. There's always something will go wrong. There's a little bit of Murphy's Law in all things, even with the best intention. And we actually, it was a little bit unique, so I won't get into it. But we had a little bit of a contractual thing, not contentious, just misunderstanding on both sides. And it again, never about the direction of what we were doing. And so probably what the vendor probably should have done is stop production, right? So they are now working somewhat without a contract or something that everyone thought we were covered with. And that's where the relationships go back, right? And so I was fortunate enough that they trusted me enough and I trusted them enough that we continued to work through this. And ultimately it took 6 weeks to get resolved or so, but we got it resolved and we were just about ready to go live at that point. So there's always going to be something, and that is one thing that we've learned is I don't know that I've ever had a super smooth, implementation. Some are smoother than others, but you always have to, if it can happen at some point or other, it will happen.
Makes sense. And Chris, based on what you've said so far throughout this episode, just till now, the word relationship has come up quite a bit. The word trust has come up quite a bit. And I've heard this from other leaders as well, where they say healthcare and RCM in particular is a very trust-based, relationship-oriented engagement. The message is really resonating with our audience. With that, how do you track success for this program? Like, what were the success metrics that you signed up for, and is it trending in the right direction?
Sure. So it's still somewhat new, just got back and got it implemented, but it is absolutely trending in the right direction. Success to me, it's still all about people, right? It's about the people matter most. Our patients obviously matter most, our employees matter most. And success to me for this program looks like a follow-up rep who she finishes her day, shuts down her computer, and understands I did what was expected of me today, right? I don't want, sometimes work queues can be endless and there's alarm fatigue and everything that goes along with that. And that's stressful. Hey, did I do enough? Could I have done more? And so we want to be very specific about here's your workload. It is going to be customized to what's truly, it's going to be customized to the point where we know you can be successful. We want to put our team members in that position. And then for their manager to understand, all right, of the however many accounts that I had to do that day, I did them, shut my computer down, I'm good. But what were the actions that I took? And then what were the result of those actions? Is someone else taking a different one? Is there a certain payer that likes these and don't? And that gets back to consuming the data, right? And so one, it's for the staff. Two, it's for the manager from a training perspective. We just we did not want it to feel like Big Brother, right? Like that's not our option. We wanted it to say, hey, this is a tool to make us all more successful. And so the other thing, again, it goes back to being on time. It's an ability to say, here's what's due today, or really due this week for follow-up. Here's the capacity you have based on how many people are off for the holiday or vacation or whatnot. And so it allows us to manage it real time to say, hey, we're going to need help next week, or versus 2 months down the road we realize, hey, we got behind and we didn't catch up. So that is one of the hardest things in revenue cycle is once you get behind, it's difficult to keep up. So you know, th- maybe that's not a traditional KPI that we see, but that's really what I'm looking for to make this successful. Certainly, we expect an AR day decrease. We expect a cash acceleration, and believe me, my CFO will ask for those to make sure we made a good investment. But it starts with the people, and if we can make that work, the process, I think the KPIs will fall into place.
You mentioned you were not looking at it from a traditional metrics perspective, but in my mind, when I heard your response, it almost felt like you cared deeply about productivity and people happiness of your team members. That in itself is a very powerful metric. And to me personally, it's a powerful lesson learned. So thank you for that, Chris.
Well, thank
Uh,
you.
with that, let's take a short break. When we come back, we are going to talk to Chris about the role Agentic AI will be playing in claims denial management. Please stay tuned.
The RC Executive Lounge is proudly sponsored by rchq.com. That's ARCEEHQ.com, where Agentic AI is transforming how providers manage patient payments and financial aid. Providers using RCHQ are seeing more collections, less manual work, and greater access for patients in need. Visit rchq.com to learn more about the platform and schedule your personalized demo.
Welcome back, everyone. Chris, I'm very excited to be talking to you in particular about this topic because of your depth of experience. A leader of your caliber, what role do you see agentic AI playing in claims denial management this year, the next 12 months, or when you look at the next 3 to 5 years?
I, I think it is a really exciting time with agentic AI, just AI in general. And I think I mentioned this before, just 12 or 18 months ago, it was kind of a, hey, let's see where this is going. You had 5 or 10 years ago, some of the organization that came out from an automated perspective and things didn't end up as planned. And so you want to take a look and see what's happening, maybe not on that bleeding edge kind of, but I think that's changed already. I think now we are very much at a go, go, go. We want to be keeping up with the organizations that are in front of us. We want to be learning from those organizations, but we do not want to be the laggards here when it comes to agentic AI. Um, you know, I don't think it's a silver bullet. I don't think people say, "Hey, is this just really going to decrease denials?" And unfortunately, I don't believe so. Maybe that's my negative take on today. Because we've seen so much in the industry before, right? The standard data sets, the 835s, 837s, that was going to change everything. Managed care, that was going to change everything, and so on and so forth. And they really didn't. If anything, we ended up with more denials, and we're obviously seeing AI from a payer side too. I mean, I think if anything, they're ahead of us. So now we are chasing them a little bit, but I don't think it's going to solve the industry's denial problem. That's just too big of business on the payer side, just to be frank. But if we don't keep up with the rest of the health systems, it's going to be hard for us to be successful. We do want to be at the forefront of revenue cycle. And so we need to be able to understand. I think there's a huge opportunity for cost reduction here. And we are, we really haven't seen cost to collect metrics move that much, but we are starting to see now. A lot are saying, cost to collect metric on the hospital side is at 2%. I don't Maybe I missed something, but I don't ever remember seeing 2% cost to collect. We're certainly not there from an Erlanger perspective, but that is where we can really, and this is not to replace our people at all, but it's to be able to make us more efficient, and really see, are there less vendor partners that we need that we can now solve with agentic, and but it's also making sure that our organization trust what we're doing, right? This is new. There's a trust factor about this. So what's a use case that we can really go down, that we as revenue cycle leaders can trust it, that our executives can trust it. And I think if we start there and win that, we can continue to expand it. So really excited about the future with agentic AI.
Makes sense. And when you think about applying agentic AI to various areas within claims denial management, obviously there are areas where it'll be a small incremental 10 to 15% improvement versus areas where it'll be a big step function improvement in the order of like 2x to 3x, right? In your mind, are there such areas where agentic AI can truly shift the game, not just incremental improvements, but the 2x to 3x step function improvements?
Um, You know, I hope so. I certainly hope so. I think there are areas that can, at minimum, help us from a cost perspective. We think about coding automation. That's a tremendous opportunity. Coders are so talented. It is hard to find coders. We've got a fantastic leader here who started a coding school, and is just done a wonderful job, but it's even hard to find people there, and so we look to an outsource perspective in a big way, and we think we've got opportunities to really save there. But it comes down to, are our physicians going to trust it? Are our leaders going to trust it? Do our coders trust it? Do our auditors trust it? And so, yes, I do think just speed, right? When we talk about DNFB, CFB, coding is one of the hardest things to keep up with at any organization I've been to, and that is not just an indictment of coders, because it's not. There's so many things that have to be there for them to do their job, and they've got to be there and be there timely. And so, if we can do those things, and we can really push towards that automation. That's a little bit further ahead of just the AI coding is anyway. A lot of it's on the physician side and on the really more straightforward. We don't see a lot of inpatient coding automation quite yet, although we've got a pilot that we are within contracting right now. And then we don't see a lot of the surgical automation, although we are starting to see companies start with that a little bit more. So it's not just coding, it's documentation, standardization. I think those are the things that can really move the needle for us. In theory, they work. We have to see them to make sure that we can cross I don't know, there's a finish line, but we can make sure we get to the metrics that we were hoping to get to.
Makes sense. And wherever you go, be it HIMSS or HFMA, it is always about agentic AI. But obviously, there are many other new technologies coming in the market every 6 months or so, right? So with respect to claims denial management, are there other technologies that you are watching closely or your team is watching closely?
Yeah, so this is probably a little bit of outside of the RCM space, but just to be honest, something that we are watching very closely, I'm very interested in is health insurance alternatives, right? Maybe I'm a dreamer. I am a dreamer. Um, but I do think that there's a world where denials go away. And at some point we have to look at the value. When we look at just the administrative burden of all of it, we can do it faster with AI, maybe, and maybe we can do it a little bit cleaner, but it's not going away, right? And so, is there a world where the system really starts to change? I think Chris's opinion here, let me take my Erlanger hat off for a minute, but Chris's opinion is just, um, y- you know, um, I think we misunderstand risk in this industry a lot. I think we really think of an insurer as owning and taking on and managing risk, and that's just not true anymore. It is the provider has risk, the employer has risk, and that's where the great majority of it lies. Yet all of the administrative burden happens in between those two things. And it's really backwards from where our dollars go, right? And so you start at traditional Medicare, and it's where the most dollars go in terms of paying claims because of volumes. Yet that's the least amount of administrative burden you have. Back up to Medicare Advantage, still a lot of dollars going out. I think, not that this is all the administrative burden. It cost 80 cents or something like that, if you believe the data, and I do, to work a traditional Medicare denial. It costs about $47 to work a Medicare Advantage denial. It costs about $63 to work a commercial denial. So when we think about our youngest and healthiest population being the most expensive in terms of value extraction from the process, at some point we've got to figure out how to solve for that problem, because that just doesn't make any sense to me.
I completely agree with you. I think the numbers you gave clearly say that it is backwards, and it's a very powerful message to our audience. That was a really great discussion on agentic AI. With that, let's take a short break. When we come back, we are going to be talking to Chris about leadership challenges faced in claims denial management. Please stay tuned.
Today's episode is sponsored by rchq.com. That's ARCEEHQ.com. If you're looking to reduce friction in patient payments and increase access to financial assistance without overwhelming your revenue cycle team, RCHQ's Agentic AI platform might be exactly what you need. Head to rchq.com to learn more.
Welcome back, everyone. Chris, let's dive right in. This is hopefully a bit of a fun question. Every leader obsesses over one metric or maybe a few metrics that they look at every morning. And they come in, they open either after checking email or the first thing, they look at the dashboard. Is there such a metric for Chris?
Absolutely. Um, and don't tell my CFO that I didn't answer the word cash, but like that's important that we know it every morning. But it's process. Rev Cycle's process driven, and so it's definitely a candidate for bill is the biggest for me, and that's kind of an epic term. It's a function of DNFB, but it's really looking at what didn't go out on time, and I just don't think you can be successful, or you certainly can't be at the forefront of revenue cycle metrics if you're not on time. I think you have to start there, and you really have to understand, okay, of what didn't go out, why, what can we do about it, is it avoidable, is it unavoidable, those types of things. So that's the one for me, that every day I want to know, and then I want to know, within our areas and our different leaders and the different owners, all right, where are we, what direction are we moving?
Now, when you're looking at the range of denials, we talked about it earlier, right? Like 4% to 27%. Having experienced the ranges in different organizations in the past, what do you think are some of the biggest challenges faced by leaders such as yourself and faced by organizations in bringing step function improvement to reducing denials?
Yeah, it's interesting in different organizations, how we look at denials, there are different categorizations sometimes, and that is something that I think Epic's done a pretty good job of standardizing. That's not bulletproof either. But yeah, I think you have to understand really what leadership wants in this, and you have to do a good job of being able to tell the story. It's easy. We all have access to the dashboards now to say, hey, why do we have patient access denial problem? Or why do we have, why didn't this get out, or that? And so it's understanding what story they understand, making sure they understand the other side of it, and then being able to give reasons for, all right, this is anywhere you go, this is out of sync or out of where we want it to be, but here are the action steps that we are taking to move it. So I think that's important, is you have to be able to tell the story and kind of back it up, make sure your team understands as well.
Makes sense. And earlier in the conversation today, we talked about the competing priorities or the tug of war between the technology team and the operations team in terms of short-term operations requests versus medium to long-term innovation requests from the technology team, right? So when you as a leader take up a project that's either innovation or operations, how do you build momentum for change when implementing claims related changes across these teams, knowing that this tug of war is always a challenge in implementing such a project?
Yeah. I think one of the most valuable lessons that I was fortunate enough to learn was in my 20s. I worked at MedAssets at the time, was project manager. And so I really, the first time managing projects, I didn't have a team under me. I had not managed people before. And I thought as I was working with that, if you can get people to do what they're supposed to do on time and they don't work for you, once people do work for you, that's got to be simple, right? You just ask them to get these things done on time. And the lesson that I learned was it is exactly the same, whether they work for you, whether they do not. And so if you can't articulate the why, we picked this project over this project, or why this is, going to go on the back burner for a little bit, and why we're going to prioritize this. Again, you can't really be successful. So I have done my best, to make sure our team understands. And I say, hey, you do not have to agree with my decision, our decision, but you do have to understand why we made it. And so that has always served me well, in that, hey, this is what's first, here's why, and we can talk about it. I I always have hey, we can shut the door and we have any conversation that we need to, as long as once we open the door, we're back on the same page. And I think that's the biggest thing is just people understanding these are both important. We need to do both of these right now. We cannot do them both successfully. And, every department, and I was the same way when I was running a revenue integrity department or whatnot. My priorities were the most important. And I believed that at the time, and so do they. So it's helping them to understand how everything fits together because, as you know, in revenue cycle, it certainly does.
Makes sense. Given your depth of experience within RCM, if you were to give one piece of advice to another CFO or RCM leader tackling denials management challenges, what would it be?
Focus on prevention. I think it's, you know, we can have conversations all day, and I'm happy to do it about what this payer should do, what that payer should or shouldn't do, or whatnot. But the reality is, we still own so much of it, and there are simple things that we can do to get right to prevent a denial in the first place. Low dollar claims are so expensive, and I think it's so easy to focus on the $100,000, $150,000 denials, and those claims are going to deny 100% of the time. You just as well say. I mean, I'm sure there are some exceptions. I don't ever see them, but I'm sure there are some somewhere. But it's your lower dollar claims that drive yield. And so to not have to waste a resource on a $250 claim because you failed to do something or didn't catch something or we didn't properly edit for it, is a resource waste on something else that is a higher dollar thing. So that's the biggest thing is don't just look at high dollars, look at the entire revenue cycle. If you really want to improve yield, you're probably not going to do it quickly with high dollar claims, but you can do it with thousands and thousands of low dollar claims. So I think that would be my advice.
Makes sense. Last question to close the episode for today. And hopefully it's a fun question, Chris. Is there a recent book, a podcast, or a framework you read somewhere that significantly influenced your leadership thinking as it applies to claims denial management?
Well, I want to give a shout out to the Revenue Cycle Executive Podcast. I think this is awesome, and
Thank
I'm
you.
honored to be here. I truly am. So thank you, Praveen. I just did a, master class on it was done by the Navy SEALs. I thought it was fascinating. I grew up in Virginia, not far from Norfolk, where the SEAL team is based, and so I've always been kind of fascinated with them. And they really talked about simplifying and accelerating decision making. And that is something in large organizations, especially, it is easy to say there's another layer to slow us down. And they talked about a couple of things that really stuck with me and areas that I need to work on as a leader, just to be frank. They talked about complexity masquerading as thoroughness, and that is healthcare to a T, right? Don't let complexity that's really shouldn't be complex keep you from making decisions, right? So I love just the talk around that. And they also talked about making decisions when you're 70% sure. And so that's something that I've taken back to my team to say, hey, our directors, even our managers, if you're 70% sure, I want you to make the decision. And if you're wrong, that's on me, right? So I would rather us quickly make the wrong decision than take forever to, eventually make the right one, as long as, there's no patient harm or anything involved. And so, and I think the takeaway from that is one, I don't want to be the bottleneck, right? And no one really wants to be the bottleneck, but we have to create future leaders too. And I think it's a little bit harder today. The fact that so many are remote, it was a little bit easier when we could walk down the hall, have that conversation. That's what we miss, I think, sometimes from Zoom. So we have to create actually, future leaders is not the word. We have to create future owners, right? It's when we feel like we're owners, I think, is when we lead the best. And so those things kind of simplifying, right? How do we simplify and accelerate decision making? And I think when we get to that, that's helpful. So anyway, I would recommend that master class from the Navy SEALs anyway.
Chris, thank you so much. Looking back at the conversation, there were so many amazing insights specific to claims denial management, but my personal favorite is the way we ended the conversation, which is how do we drive decisions even when we have only 70% of data or we are only 70% sure? That's a really powerful insight Great way to end the episode. Thank you so much again for sharing all these insights very candidly with our audience. I know our listeners are walking away with a lot of lessons on claims renewal management. Thank you for joining the show today.
I really appreciate you having me. It's great seeing you.
Thank you, Chris.
Thanks.
The views expressed by guests are their own and do not constitute endorsement of any specific product or solution.